Hi, welcome back to my channel. I'm Dr. Aziza Sisse, a GP with a specialist interest in women's and gynecological health. We're back with the myth-busting series, and today we'll be talking about women's and gynecological myths that need to be thrown in the bin. Myth number 1, heavy, painful periods are just one of those things to live with. This is such a common myth that has meant a lot of women and people who menstruate have had to endure excruciatingly painful and heavy periods for a long time. Though it's true that hormonal changes occurring during the period can contribute to the pain experience and the bleeding associated, it doesn't mean that they have to be so intense to the extent that they affect an individual's livelihood and ability to do basic things. There are many underlying conditions that potentially attribute to these symptoms, including fibroids, endometriosis, adenomyosis, conditions that affect hormonal imbalances like PCOS and hypothyroidism, and so on. There are several treatment options available, from medication to surgical interventions where necessary. It's very important to see the doctor for appropriate assessments and investigations, as well as management. And when we talk about heavy periods specifically, it's vital to stress that they can lead to severe anemia, low iron, which if left untreated can be quite debilitating and life-threatening. That's why I urge anybody with these symptoms to please go and seek help. Do not suffer alone. Myth number 2, painful sex is just something to get on with. Sex should never be painful. There can be underlying causes for the pain. In older women, it could be related to vaginal dryness associated with menopause. And there's also conditions like endometriosis, which is actually quite common, affecting 1 in 10 women, but it can take almost a decade to diagnose. There's also vaginismus, in which there's involuntary spasms of the pelvic floor muscles, which makes penetration difficult and painful. The reasons vary from physical to psychological or both. What I'm trying to emphasize here is that there is support available to help manage painful sex, from pelvic floor physiotherapists to psychosexual therapists to gynecologists and so on. Sex does not have to be painful, and you must not continue to endure this because of that false narrative that it's normal and to be expected as a woman. No. Myth number 3, vaginas need to be cleaned with intimate products. To begin with, the vagina is the muscular canal that connects the womb to the outside. It's part of the internal gynecological anatomy and is commonly confused with the vulva. The vulva is the external part of the gynecological anatomy, which consists of the clitoris, inner and outer labia, and the vestibule, which holds the urethral and vaginal opening. The only aspect of the vagina which you can see from the outside is its opening, and very, very rarely a tiny part of its lower aspect. Now, it's crucial to remember that the vagina is self-cleaning. It has its own naturally balanced environment that is self-maintained. And this balance can be disrupted by the insertion of things into the vagina. And that includes douching, feminine hygiene products, and even water, which can lead to inflammation, infections, and polyps, and so on. It also serves as a means for chemicals within those products to spread to other areas of the internal gynecological anatomy, and this too can lead to harmful consequences. The vagina does not have to smell of fresh flowers, berries, or roses, despite what popular culture encourages. Let it do its job. It's really good at it. The vulva, however, can be cleaned, and usually water will suffice. If you do want to use soap, please use mild, unscented soaps. Myth number 4, genital itching and discharge is always a yeast infection or thrush. Genital itching is a common complaint that a lot of women and people with gynecological organs experience. Though yeast infection is a usual cause, it's important to be aware that it's not the only reason for its occurrence. Some causes can be serious and require appropriate intervention. There's vulval lichen sclerosis, for example, which is a condition that frequently causes itching, white patches, sores, and tears in the vulva. And it's also a cause of genital itching and needs to be managed early. If it's left untreated in the long term, it can eventually progress to vulval cancer in about 4% of the cases, according to Cancer Research UK. This is why it's always important to seek support from your doctor for further assessment, particularly if the vulval itching with or without discharge persists or recurs. Myth number 5, periods are unhygienic or dirty. Listen, periods are a biological process, and as part of the menstrual cycle, the inner layer of the womb, called the endometrium, thickens in preparation for a fertilized egg. If this does not occur, it is this area that is shed and comes out through the vagina as period blood. This contains a mixture of blood, vaginal fluid, and the cells and fluids from the lining that is being shed. Having a period is not your body's way of flushing out toxins, nor is it rejected bodily fluid. It's a natural process that occurs due to hormonal changes as part of the menstrual cycle. It is definitely not dirty or unhygienic. I hope that you found this useful and it has helped to debunk some of those common myths that we were taught over the years. There is still a lot of unlearning needed. Hopefully, this will come with time, but for now, let's continue to raise awareness about the facts and challenge the misconceptions. And also, share this video so more people are aware of what the myths and misconceptions are so they can separate the facts from those myths. Thank you so much for watching. Don't forget to subscribe and click that notification button so you get the alert when the next video comes up, and I have loads for you. See you in the next video. Bye!